Hello, ladies and gentlemen. Greetings. This is Khabir Southwick from beautiful Ojai, California. And this webinar today is on understanding imbalances and disease of the respiratory system. And of course, this is based on Ayurvedic knowledge. So I'm presenting my understanding of Ayurveda and treating and diagnosing and understanding respiratory imbalances based on Ayurveda. So I hope this is helpful for you and helps you to understand your own respiratory condition and hopefully to be able to better to manage your respiratory system. And this is an ancient knowledge, of course, Ayurveda. And so we're not using medical terms here, but practical terms that you can easily understand. And there's very practical remedies and treatments for most respiratory conditions. So in Ayurveda, they actually refer to the respiratory system as a prana vahu sutra. So that means the prana, life force, system. So because once our breathing has stopped, our life is finished. And we could say prana is oxygen in a way, but I think it's more than that. It's the life force that we're gaining from breathing. So once our prana, our respiratory system stops, life ends. So it's very important. I think it's not understood or acknowledged the importance of having healthy lungs and a well-functioning respiratory system. For example, many people have snoring and they don't see this as an issue, but this is a early stage of a blockage in the respiratory system. People have constant or runny nose or hay fever, and they don't realize that this type of blockage or restriction or in their respiratory system is affecting their ability to not just breathe, but to get prana or oxygen into their body, and has many adverse effects. So when your breathing is and your lung capacity is not at 100%, then your health cannot be at 100%. It's one of these essentials for a healthy human being to have good digestion, good elimination, good sleep, and good breathing, because if our sleep is poor, our health will be poor and we'll be weak. And if our breathing capacity of our respiratory system is minimized, blocked through either congestion or dryness or inflammation, then our overall health will be affected, because our entire body depends upon the prana, life force, including oxygen that's derived from our breathing. So we shouldn't take these imbalances lightly. Ayurveda says prana is the vital life force that maintains cellular reception and the flow of intelligence and communication. So it's more than just CO2 and oxygen being taken in and out of the body. We know that the respiratory system has many functions, the gases, exchange of different gases, and of course the excretion of toxic gases. So it is an eliminating organ as well, because we're eliminating toxic gases, just like our colon is eliminating organ, our skin is sweating, eliminating, our urinary system is also eliminating. Well, every exhalation that we have is an elimination. So of course it's maintaining the balance between oxygen and CO2, but also maintaining an acid-base balance in the body, and also maintaining the body temperature. And we're going to, of course, look at our respiratory system based on the Ayurvedic perspective, which is a tridoshic system, where we'll be looking at it from the point of view, is the imbalance that we have vata, pitta, or kapha in its type. But we need to know how to diagnose these conditions, to know what we have, and we would need to, if you're a practitioner, we need to examine the heart, the lungs, the nose, the throat, trachea, and examine these and ask questions to determine the state of the respiratory system. So because we're talking about Ayurveda, we're not using so much terminology of bronchitis or asthma, but we look at it from the three angles of the system can have certain imbalances. One, the respiratory system can be overly active, hyperventilating. The respiratory and that's connected with, of course, our nervous system, stress, and other systems in our body. And then the respiratory system can have shallow breathing, underactive. So there's overactive, underactive, and then there's a vata imbalance. And you want to determine which of these categories you are in, particularly whether you're a vata, pitta, or kapha imbalance in your respiratory system, because the treatments in Ayurveda are based on the type of imbalance that you have in your respiratory system. So there's often not just one cure for allergies in Ayurveda, because there's many types of causes to respiratory allergies. And some people have a type of dry cough, while other people have a more productive cough with mucus. So you can't say what's the herb for a cough, because there's different types, just dry or productive or non-productive, for example. Same with difficulty breathing. There could be a dry type of difficulty in breathing, and then there could be a kind of clogged up type of breathing where, you know, the nasal passages are clogged and this type of congestion. But both are restricting and inhibiting the breathing and blocking this system, this respiratory system or pranavayu sutra system. So let's look at the vata imbalance first. We know vata by nature is dry, light, cold. So maybe this person who would have this type of breathing problem, their body would also have dry skin. They'd be light in weight and tend to have a colder body temperature, cold hands and feet. And, you know, the type of conditions we would have for this, if there's too much vata, which is too much dry, light, cold in the respiratory system, we ended up with a dry cough. We can have shortness of breath, where difficulty breathing when we lie down, and, you know, breathlessness, where we're out of breath, or hyperventilation, where we get too excited. The vata is a sensitive person, nervous person, so they have anxiety, nervousness, and this can create this type of rapid breathing. Now, of course, in that case, we'd want to treat the nervous system, because that would be the cause. So somebody's having a panic attack, they're having a panic attack. We don't treat the breathing problem, but we treat the nervous system. That's the cause behind that. But if you have dry cough, like wheezing, which you can hear by listening to the lungs, then this would be, we call vata type of respiratory condition. It's mostly dry, difficult, and shallow, and you can have more difficulty when lying down. So for those of you who have a vata in their respiratory system, you probably have dry skin as well, because this dehydrated state affects the lungs. The lungs have to remain moist and for the alveoli to not become restricted, and the bronchi to remain open. And dryness is very harmful to the lungs. So the cause in this case could be dehydration alone. But we'll get to causes in a minute, and we'll get to treatments in a minute. Let's go to the next type of respiratory imbalance. We have this vata, which is this dry, cold, and coming mostly from dehydration, cold weather, cold breezes, cold air. These are typical causes. And then we have a kapha type of respiratory condition. And kapha, we know, is heavy, dense, thick, mucus-like, and slow and moving. So we're going to have symptoms like hay fever, runny nose, cough with mucus, not a dry cough like in vata type, allergies, snoring. So, that's a blockage, that snoring. That's the beginning of the problem. A lot of times people come to me with respiratory problems later in life, not the one they have when they're children, where it's more related to their immune system. Then I say, what about 5-10 years ago? Did you have this respiratory condition? They said, no. I said, did you have snoring? And they said, yes. I've been snoring for 10 years. So, snoring was just one of the early signs that they ignored. And in any respiratory congestion where one nostril you're not able to breathe through, you should be able to breathe through both nostrils at all time, even though depending on the time of day and many factors, we're breathing through one nostril more than the other. But this is where we would have allergies, respiratory allergies, bronchitis, asthma, phlegm with mucus. So this is a productive cough with phlegm. You're spitting something out, there's phlegm coming out, there's mucus, you have to blow the nose, you have to do the neti pot. Oh, that reminds me, why don't we get a neti pot over here? And we can talk about the importance of neti pot as well. And that's to break up this congestion. So that's the kapha type. It's very clear. It usually comes with an overweight person, heavy person. And there's blockage, congestion, phlegm, mucus. So very different from the dry wheezing type of vata. So it's the dry wheezing type, and then there's this congested. Now the third kapha type. Then the third type is a pitta type of imbalance. And we know pitta represents fire, and is generally, we see symptoms of it with inflammation, pain, burning. So this would be coughing blood at that point would be pitta, just a sore throat, pneumonia, and painful breathing, or any type of respiratory infection. Once you had an infection in the respiratory system, then, of course, then it would be a pitta case. So you could start with just having dry, difficulty breathing, and then the body excretes all this extra mucus from the stomach lining into the lungs to lubricate it, and then we can get too much mucus, and then in this mucus creates the environment for infection. Also, we can have cold foods or congestive foods like cold milk and yogurt and block the nasal passages, and then this also can create the environment for infection to take place. So those are the three categories: the dry vata type of respiratory issue, the congested, clogged kapha type, and the infected, sore, inflamed type of pitta type condition. So you want to classify yourself in one of these three categories, because we're going to talk about the treatments for these three categories differently. So, saying you have a breathing problem or respiratory problem is not that valuable. You really have to look at these symptoms and break it down to be able to properly treat it. But before I do that, I want to talk about some of these causes. What's causing most of these respiratory problems? Of course, toxic fumes, and that would be carbon monoxide, pollution. These are some of the main causes. Chemicals in the air, these affecting the respiratory system by getting in the alveoli. And they're like toxins. Like you could have toxins in your liver, you could have toxins in your colon, well, you can have toxins in your alveoli, these pockets inside of your lungs that are exchanging the oxygen and the CO2. And they can be congested, they can be inflamed, and they can be kind of dried up. So if you're taking in carbon monoxide from living next to a highway, or you live next to a paint factory, or inhaling fumes. I've heard people who worked in dentist office who were inhaling a lot of fumes, ended up with respiratory problems. People who live next to industrial plants or factories, or worked in coal mine type situations, then they end up with these respiratory problems, and often pitta in nature, where there's infection, there's pain, there's a sore throat, and that's because these are toxic substances, and then the body has an immune reaction, and this creates the inflammation. So what are the herbs doing? In this case, they're cleaning, bringing down the inflammation, cleaning out the alveoli, the bronchi, and removing these toxins, just like we would remove toxins from our liver. Other causes, of course, are just pollen, dust, and in the air, and a mold. somebody mentioned that before we began, that they had mold in their blood work, and this is very common, particularly in damp climates like Hawaii, or where there's a lot of moisture in the air, or in your shower, or maybe you haven't cleaned the shower wall for a while. You can have mold in there. You can have mold under the sink, and then you could be cleaning under the sink, and you can get this mold in you. Some houses have mold in the wall. But once these spores get in your respiratory system and lodged in your alveoli or bronchial tubes, then you have a type of reaction, and that reaction is going to create inflammation, discomfort, and affect your breathing. So again, we are reducing inflammation and clearing out these toxins out, and we're going to talk about some of these cures. We have many cures. Also, just having infections, a respiratory infection can weaken the lung, and even trauma to the lungs, maybe a car accident or falling, and cold weather. The lungs really require a moisture and warmth, like most of the body does. So if it's dehydrated and dry, or it gets too cold, then this reduces function. And this is why we say we have a cold, because the cold weather, we're breathing in the cold air, and then this creates the mucus, and then within this mucus creates the environment in which infection can take place. Ayurveda focuses on the terrain, not the seed approach to these type of infections. Well, the Western approach sees every pathogen or bacteria as the cause. Ayurveda sees that it's the terrain. And I think that makes more sense, because you could say, have a child in school where half the children are sick with a respiratory infection, while the other half aren't. So that means that this bacteria was in the air, they all breathed it in, and only half were infected. So what's more important is the condition of the respiratory system and the immune system to be able to fight off this infection. So we've always gone in the Western society towards more sterilization, sterile, and this, of course, has made the immune system actually weaker in many people by living too sterile of a life, and then they're not able to deal with other pathogens and bacteria, both that we breathe in or that we eat. So it's very important to keep the immune system strong and keep the respiratory system functioning at maximum capacity. And you can get your lungs tested to see the capacity of your breathing, and this is very valuable to know, particularly if you're doing a type of herbal treatment like my patients do. Then they can see the improvement. I've had a client recently whose daughter had a breathing problem, and she said she only had 60% of her lung capacity, and she took some tea from me, which we'll talk about some of these herbs in a minute, and then majority of her lung capacity increased with just one bag of tea. So these herbs work very well in improving respiratory function. Other causes, it's just grief and sadness, and suppression of coughing, sneezing, and yawning. Just like if we suppress urination and we don't go to the toilet right away, then we can create the environment for urinary tract infections. So same here, if we're holding back our sneeze, our cough, and we don't really let it out, then this can be damaging to the lungs, which are very delicate in their bronchi, and create other health issues. So always don't suppress these natural urges. When you need to go defecate, then you need to not hold it in. When you need to urinate, you need to go. And when you need to sneeze and cough, you need to sneeze and cough and not hold it in. And of course, swimming in cold water, and many stimulants like caffeine, alcohol, tobacco, and smoking any substance would be harmful to your respiratory system, because smoke is dry and hot, so it's very penetrating. So this dryness is harmful to the respiratory system, and the excess heat can be damaging to the like the villi, the hairs, and the lungs, and damage them. As we know, smoking cigarettes can, and create buildup of tar and block the ability to even absorb oxygen. As we know, this is one of the major problems we have with smoking tobacco or any substance, and this can lead to, of course, lung cancer. So, any cancer doesn't start overnight, whether it's in the colon. There's usually a long history of constipation or inflammation. It's going on, and then eventually we have diverticulitis, and then maybe colon cancer. But here in the respiratory system, we have history of maybe smoking or living in a polluted area, respiratory problems, breathing problems, snoring, sleep apnea, and different conditions. And then eventually you can have lung cancer. So, lung cancer is kind of the accumulation of these imbalances not being resolved. And of course, insufficient physical activity. And as I mentioned earlier, extreme dryness is very harmful to the respiratory system. So let's talk about a few little home remedies first. And I'll refer to whether we're talking about the kapha or pitta type. So let's start with the kapha type, most common, where we have congestion, blockage in the respiratory system. So some of you, of course, have air filters. Air filters are very valuable. I have a couple air filters here in my office, and one running all the time in my bedroom, and they're very helpful. And even plants. I have quite a few plants in my office. You can't see all of them, just a few here. And they help to clean the air. And of course, I live up in the mountains. So, when you're living near plants, there's a higher amount of oxygen in the air because the plant is producing this oxygen for us. So it's why we all love to go to the mountains and to the forest and near the water where there's more oxygen. So I recommend everybody get air filters, particularly if you're having kind of breathing problems. And then another thing is to get a air humidifier. And they're very cheap. You can get these in the pharmacy for $30. It's just a big tank with water and a little fan, and it just blows more water into there, and it humidifies the air. And this is very helpful for the first type, the vata type, dry. So you have this dry breathing. Maybe you live in Arizona or somewhere where it's very dry. Then you can get a room humidifier, and particularly when you're sleeping. And of course, if you have wheezing or a dry cough, then this can be very helpful. If you have mucus and congestion and phlegm, or even have a child or a baby who has mucus and phlegm and congestion, then you should get a humidifier. And a humidifier that can add essential oils to it. And that's creating the steam. And usually right where the steam comes out, there's like a little pocket there. And you can put the essential oil there. And of course, you'd want to put there eucalyptus oil. Little eucalyptus oil. And eucalyptus oil is one of the most powerful bronchial dilators and decongestant there is. I mean, even just inhaling the eucalyptus oil just out of a bottle is very powerful. Sometimes I put it in a little tiny bottle with some rock salt and put in the eucalyptus oil there, and then give it to people to just inhale. But it works very good in a humidifier. Like I said, if you have a child with congestion, runny nose, clogs, or having difficulty breathing, you put this humidifier in the room with a little eucalyptus oil, and while they sleep, they'll actually be clear in the morning. There's other little things we can do, little home remedies that I have. This is crystallized mint. I actually got this in Morocco, but you can get it here in the United States. And this is black seed. We often call it black cumin seed. And what we do is we put it in a little sack like this. I put some in here. And you just put in a tablespoon of the black seed in there. So I got the black seed in the sack, black cumin seed. You can order that on online. And then I put a little bit of the mint crystal, just one little piece. You don't need much. Put a little crystal in there. And then you drop it in a sack and close it up. And then you kind of grind up that crystal in there like that. Wow. And then you inhale it. Really clears it up. If I keep doing it, my eyes are going to start watering and clearing up. And in fact, today I had a client today, who had this condition, and I gave this to him just as something to help him out, not necessarily getting rid of the cause, but helping. You can carry it in your pocket and you can breathe it in. Woo! It really clears it up. And you could put a few drops of eucalyptus oil in there as well, and this will help clear it up. So those are little home remedies you can do as far as, and that's mostly for this mucus and congestion, not infection, not dry cough. So let's look at a tea here, also used for mucus and congestion. See, it's called lung tea, and provides relief from respiratory congestion, cough, asthma, and bronchitis. And the first ingredient is L-champagne. And L-champagne is one of the premier herbs in Western herbology for breaking up congestion. It's a bronchial dilator, decongestant, and very effective. And we mix that with some other herbs, colt's foot and comfrey root, marshmallow root, or slippery elm, mullein, licorice, and a little ginger, and some black pepper. And again, the black pepper is to open up the respiratory. And colt's foot is very famous. It's generally good for coughing. So if you just have chronic coughing, you can just even have colt's foot tea and honey. And mullein is also very famous. We even can be smoked to help in the respiratory system. It's so mellow that you can actually use it for people who are trying to quit smoking tobacco. We mix mullein with a few other herbs and then mix that in with their tobacco. And then they're able to, it's actually beneficial to the respiratory system to be smoking mullein. So it clears them out and allows them still to wean slowly off of the tobacco. Maybe I should do a whole video on that subject. And then the comfrey root, marshmallow root, and slippery elm is just to take away the dryness and moisten the whole respiratory tract and the bronchi. And this should be taken with honey. And this tea is mostly for congestion, difficulty breathing, not so much for dry breath and not so much for infection. It's basically for that asthma, bronchitis, chronic cough, and should always be with honey. And of course, when you put honey in it, you can't put honey in any type of boiling water. It becomes toxic. You have to wait until the water's warm and then add the honey. A good home remedy is to get, for congestion, is to get honey, good honey, raw honey, not the cheap stuff with sugar in it, and then get some black pepper. And we use P.A.C.E, which is a type of black pepper. It's not quite as hot, better for respiratory conditions. P.A.C.E, sometimes it's called Indian black pepper, and grind it up so it's very fine in the coffee grinder. Just grinding it up alone, and the fumes from that will get you sneezing and your nose will start running, just grinding up black pepper. But anyway, grind it up from a distance so you don't, like you cut onions, and then get that black pepper and mix it with the honey, like 1/4 black pepper, 2/3 honey. So like a tablespoon of honey and a half teaspoon of black pepper, mix it all together and take it straight. This is very clearing because you're taking a half a teaspoon of black pepper. If you took it without the honey, you would probably just cry and be coughing and gagging. But with the honey, it smooths it out. Honey's anti-inflammatory, a mucoid, soothing the bronchi, and makes it into like a syrup, so it slides down the esophagus and absorbs into the chest area. And once again, with eucalyptus, another thing we can do, particularly for children with breathing problems, is you can get eucalyptus oil or essential oil and put it in some olive oil, or any oil for that matter. And then, but small amount, just like, a couple drops per tablespoon, or a half teaspoon for maybe a 1/4 cup of olive oil, and mix it up and then rub it on the chest. If you're doing on a child, always put some on yourself first to make sure it's not too strong. And that will really open it up, because, system, the skin is very porous, and it's amazing. You could put some peppermint oil right here on your throat, and you could exhale out your mouth, and you could taste the taste of peppermint oil almost instantly. So that means that peppermint oil is going right through your skin, right through your tissue, right through your muscles, into your lungs, and out through your breath almost instantly. So when you put that eucalyptus oil on your upper chest, then it penetrates right through, right into the lungs. And that's why we can take syrups, and they will do the same thing as they go down the esophagus, and they then absorb into that part of the body. And even you put the syrup in your mouth, and then it goes into, it can clear the nasal passages, because the skin is quite, and the tissue is quite porous, more porous than we realize. So if we want to reach the brain, sometimes we can put oils right on our head, and they'll just penetrate right into our scalp and our brain. So if we want to get to these nasal passages, we can put a little olive oil and eucalyptus oil right here in the sinuses. And we can also take a syrup with honey and take it internally. And that's why cough syrups and these many of these treatments are in syrup form, because if we just take it in a tea and we just gulp it down, then it's going to just wash right down the system, and we're going to end up urinating it right out, which is great if you're trying to reach the urinary tract, but not good if you're trying to reach the lungs. So that's why we do syrup. So it actually has time to absorb in the upper half of the body. So you got syrups, and you also can use, we have a nasa over here. We have some nose drops. Maybe you could bring me that, Jake. And I can show you those too. And if you have an infection, of course, in the respiratory system, a pitta type of condition where there's infection, then you have to have something that's antimicrobial. See, here with this lung tea, this is just congestion, blockage, difficulty breathing, but it doesn't mean there's an infection. Here we have another herb, another tea called cold and flu tea, and there's we'll take a look at it there. Echinacea, sage, wild grape root, Oregon grape root, I mean, and ginger, and thyme, and fennel, and some licorice. So the licorice is mild antiviral, but the Oregon grape root, now we use it, of course, instead of golden seal. 10 years ago we would have used golden seal there, but now golden seal it's become endangered and expensive. So now we're using Oregon grape root instead of golden seal. So, the old combination, echinacea and old golden seal is now echinacea and Oregon grape. And sage, which many of the Native American Indians had sage tea for coughs and respiratory conditions. And licorice is, like I said, antimicrobial. Ginger, cinnamon, thyme, and thyme is very powerful. You could make at home. Say you don't have anything and you have a little cold at home, you could get some, and you don't have other herbs, you can get ginger, cinnamon, thyme, make a tea, wait till it's warm, put a lot of honey in it and sip it slowly. And you can fight off a minor respiratory condition with that. Now, of course, we have much stronger antiviral, antibacterial, antimicrobial herbs as well. We could make stronger doses, but 90% of all people during the flu season or who get respiratory infections, this just works fine. So that's a pitta type. Once you have an infection, there's some pain, there's some infection going on. Now, we also have what's called nasa oils. Nasa oil, this is one from Banyan Botanical. And you take that. I have it here. And this is also good for it's got a little eucalyptus oil in it, I believe. And let's see what our ingredients are here. I think there's a little eucalyptus oil in it. Yeah, of course, in sesame oil, olive oil, brahmi, so it's good for the brain. Calmus, which is also called vacha, which is considered a channel opener, particularly when there's congestion. Skullcap, which is nervine, and then eucalyptus oil. So there's a little bit of eucalyptus oil in here, and you don't need much, particularly since you're putting it right in your nostrils. And this will help over the day to clear up. We just put in a little bit here, and you just put it in your nostril. And then put it on the other side. And that lubricates the nostrils. And this is very good for a dry, blocked respiratory system. Not so much with heavy congestion, but dry and blocked. Let me get a picture of the neti pot. I think we have a box of a neti pot up here somewhere on the shelf. And this is very important to use the neti pot. Neti pot doesn't necessarily cure your health issues, but it's really quite good for preventive. We just have a box here. I didn't bring, I should have brought mine from the bathroom, but that's a neti pot, nasal rinse cup. And if I would have had it here, I would have demonstrated it to you, but you kind of pour it in your nostrils in one end, putting in salt water. You don't just use normal water. You put salt water, pour it in one nostril, and then it comes out the other nostril and just runs right out. And it's very effective for maintenance. And you could put 1 or 2 drops of eucalyptus oil right in there, just a couple drops, and that will have similar effect. Even this nasa oil, which just means for nasal treatment, you can put that right in the neti pot as well. But mostly we just use salt water. People come to me with allergies and they say if they do neti pot every day, it helps, but the condition never went away. That's because it's not going deep enough into the bronchi and the alveoli to really clear them out and detox them out. So we have 2 formulas here that will do just that. You could say that these formulas, and L-champagne too has a similar effect, a kind of a detoxing effect. See, the L-champagne in that formula has a detoxing. You could call it like a lung detox. But here I have a formula that's called Respiratory Productive. Yeah, and this is for mucus, congestion, snoring, productive cough, colds, asthma, bronchitis. And we're using this a lot. And this has Talasadi, which is an Indian formula, and using Vasaka, which is another Indian herb. And Vasaka is is also known to really clear out the nasal passages. And then Tulsi for the immune system. And Talasadi is already a pre-made Indian formula for this condition. So, in Indian herbology, a lot of these herbs are already in formulas. So this is basically Talasadi for productive cough, and that's what it's used for. And then here's the other one, non-productive cough. And this is for difficulty breathing, painful breathing, dry cough, dry asthma, dry bronchitis, and it's using the formula Stipulati, Tulsi, licorice, fennel, and the Vasaka again. And this is Stipulati Churna. It's already a formula already made for dry respiratory coughs and colds. And these formulas are mixed with warm water and honey and made into a syrup and taken throughout the day to resolve these conditions. Now, if a person has an allergy, then, they're getting hay fever, or they're responding to dust mites or pollen in the air, then this is a slightly different formula. We have respiratory allergy formula, and the respiratory allergy formula has some herbs in it that are like natural antihistamines. I don't have them right here, but one of them is called Shirish, and this is like a natural antihistamine. It stops the immune system from overreacting and settles it down. So the formula is completely different here because this is modulating the immune system, and some of the herbs are similar, like the Vasakas in both, that clears out the alveoli. So all 3 of these have a detoxing effect on the body. The difference is one, the productive one is hot. It's got pepper in it. It's hot. It's heating. It breaks up mucus. And the non-productive is smooth, more licorice, more fennel, soothing, comforting. But both are opening up the bronchi. And then the allergy one is modulating the immune system and still dilating the bronchial system, cleaning out the alveoli. So we could call these like lung detox. And sometimes I'll give away, if people have cough, because the lung tea here really works better for cough than breathing problems, but often we'll combine the 2 together and they can mix them together. Very effective, as you can see from my testimonials and references. I've helped hundreds of people with respiratory conditions with a combination of what I've just shown you here today. Sometimes I'm giving them the nose inhaler, telling them to do neti pot. Sometimes I give them home remedies and using eucalyptus oil. And then I'm using one of these 3 formulas and a tea. And sometimes I have to just make the tea from scratch based on their condition. And sometimes I make the formula also based on their unique condition, because everybody doesn't always fall in one of those 3 categories. So the good news is, that a lot can be done to improve your respiratory health. And when the respiratory health is improved, like I said in the beginning, your overall health will improve. Your energy level will improve. Just like the liver, maintains your metabolism. So if you're having trouble with your liver, maybe through alcoholic liver or past hepatitis or fatty liver, then your whole metabolism will be affected and your energy level will be lower. But also with the respiratory, if you're having difficulty breathing in the day, snoring at night, or waking up at night with congestion, then you're going to have low energy all the time. Besides just that you're not getting enough oxygen, you're often not sleeping good through the night. So these issues this respiratory type of problem is something that should be resolved quickly. So if you come to me with any health issue and you're not sleeping, I'm going to work on the sleeping right away. It doesn't matter if you have some autoimmune condition. Well, of course, with an autoimmune condition, you want to improve the sleep because the immune system is very important, and it is not properly supported without good sleep. I would resolve digestion, elimination issues, no matter what condition you have, because how's the body going to achieve homeostasis and function properly if these major systems are not working? Because in Ayurveda, disease isn't the lack of symptoms, or the disease or unhealthiness isn't not having a disease or not taking medication, but health is having all the systems in the body working properly. And when all the systems are working properly, the respiratory system, the digestive system, the elimination system, the circulatory system, the lymphatic system, the urinary system, these all need to be working properly. The reproductive system is not essential for your health, but these other systems are essential. Even sweating system is for eliminating toxins. Any of these are blocked in any ways, then your health will be hampered. Your body will be handicapped, and you won't be in a state of homeostasis to allow you to heal from your more serious disease, whatever that may be. So don't be only focused on, losing weight or my autoimmune condition or my tumor, but look at your body holistically and look at all of the systems in your body and make sure that they're all working, because you'll never be able to recover unless you treat yourself in this holistic manner. And a lot of us, we talk about holistic practice. Everybody likes the sound of holistic. I like to be holistic. And I'm going to a holistic doctor. But in reality, I don't see people, practitioners, treating people holistically. If you go to a doctor or a healthcare practitioner, you say you want to lose weight, they'll give you something to lose weight. But that's not holistic. Holistic is stepping back, looking at the whole body, looking at all the systems, helping the person to get all the different systems working in their body to work properly. And then a lot of times weight issues, immune issues, health issues will resolve on their own without having to treat them individually, because they were at a disadvantage. And this definitely goes for the respiratory system, because say you're getting lightheaded, you're fainting, that you're not getting enough oxygen to your brain. Your memory can be affected by not getting enough oxygen. And congestion can stop you from getting enough oxygen in your system, reduce your lung capacity, affect your sleep, affect your immune system. And then this can escalate and create a pathology that can lead to more serious health conditions. So, address these conditions in the early stage is always the best bet. Don't wait until you have a disease, but try to address in the beginning. If you're having little breathing problems, now's the time to deal with it. If you're snoring at night, now's the time to deal with it. And if you do have a more serious condition where it's affecting your health, then I advise you to find a qualified herbalist who can formulate the herbs for you. It takes many years to become an herbalist. So, if you have a serious condition, you may not want to be practicing on yourself. It may just be better to find the cure and to find the right formula. And of course, diet is a big factor. If you have this respiratory congestion blockage, then of course you want to cut back on not all dairy, because butter isn't congestive per se, but definitely yogurt, cold milk is very, very congestive. But on the other hand, say you had this dry cough and you're dehydrated, then having a little more butter in your diet may actually be beneficial to help to support the tissue and not allow it to be so dry. So just eliminating dairy right off the bat doesn't necessarily mean it's a cure. And you have to remember that even if you had mucus and congestion and you stopped milk and dairy and it got a little better, well, you haven't treated anything. You just kind of like stopped it from getting worse. As soon as you have the milk and dairy again, it comes right back. So you didn't fix anything. So that's why you have to, one, have the right diet. We don't want an inflammatory diet. That's, if you have an inflammatory respiratory system, you don't want a congestive clogging diet with dairy if you have congestion. And we don't want a dry diet with dry foods and dry drinks and if we have dry respiratory conditions. So the diet has to support the underlying causes, but ultimately you need something stronger if you're in the advanced stages of a respiratory problem to get into the bronchi, the alveoli, and detox them and clean them out. And that's what the herbs do. So the diet supports it, and the herbs get in there and actually over 2-3 months resolve this. And if you go look at my testimonials on my website, you can see a lot of people who said, I was off of inhalers in 1 week, 2 weeks, 3 weeks. I stopped taking my asthma medication after 1 month, 2 months. So, it's not quick. It's not like overnight, but, the herbs are not expensive. They're taking them for a while. And then the breathing's getting better and better. And the people are able to reduce down the need for inhalers. And the good thing about taking these herbs is once you've taken them for a few months and your breathing's good, you may not ever have to go back on them because the job is done. You've detoxed your lungs, so to speak. You've cleaned them out. You've helped improve their function. Just like you would take a air filter out of a car and spray it off and then go put it back in the car, or a fuel filter and you clean it off and put it back in the car. That's what we're doing by cleaning out the lungs and dilating it, the bronchi, cleaning out these little pockets, these little alveoli, so you can breathe better. So that's the beauty of herbs. They actually are doing something, not just a short-term dilation so you could breathe through the day and become dependent on the medication, but actually going in and helping your reproductive system, cleaning out your lungs, cleaning out these pockets and getting this mucus, congestion, and toxins out of the system and reducing inflammation. So they're actually doing something. So that's why 2, 3, 4 months, you don't need them anymore and the problem is gone. I think this is better than long-term use of inhalants. And if you need assistance in helping to formulate such a formula that's suitable for you, then please contact me. I've been very successful with respiratory conditions for many years and many severe conditions as well. So I'd be happy to assist you in any way. And I hope that this webinar helped answer some of your questions and gives you more hope in treating your respiratory condition, and know that there's many herbal remedies that have been around for thousands of years that are still working today to address these respiratory conditions. But again, the diagnosis has to be right, and the right treatment has to be given to the right type of condition for the right dosage for the right length of time. So there's a lot of details which are hard to cover because these are individual based on the individual patient, and I can help you with this. I hope you've learned. I hope my information about Ayurveda has been accurate. Forgive me if any of my information has not been accurate. We're all learning. We're all trying to expand our knowledge of the ancient ways of healing, which Ayurveda is the oldest known healthcare system in the world. And I hope that I've at least given you this hope and inspiration that your respiratory condition can be resolved naturally. Thank you very much, ladies and gentlemen. I wish you the best of health. Greetings from beautiful Southern California. I sincerely hope you learned from this video and benefited from all the information. This knowledge is not my knowledge, nor is this information new, but part of the ancient healthcare system called Ayurveda, the science of life. I hope my videos explaining the Ayurvedic approach in a simple and clear manner helped you to overcome your health issues. However, if you have a complex or serious health condition, I highly recommend that you contact me personally so I can meet with you here in my clinic in Ojai, California, or in an online conference call, so I can properly diagnose your condition and provide you with an individualized diet and custom herbal formulas. Then I will follow up and continue to support you until you have recovered. Please subscribe to my YouTube channel below and visit my website for more information, appointment fees, upcoming events, and my schedule, where you can book an appointment directly online. Thank you once again, and I wish you the best of health and happiness.